I'm Dr. Michelle Muldrow. I'm a board-certified obstetrician gynecologist for Innovative Women's OBGYN. 1 in 3 to 1 in 6 people have been either infected or suffer from lesions or test positive. You have HSV1 and you have HSV2. HSV1 is more common orally, HSV2 is more common genitally. One seems not to be as aggressive as two, but they can also swap, right? You can find one genitally and two orally. Now, you'll be hard pressed to have someone not date somebody because they get fever blisters, which is HSV1. But if they find out the partner has HSV2, that's like a whole other scenario. So there's the stigma that comes around it. And so people are a lot more devastated to hear that they have genital herpes versus oral herpes, even though it's really the same thing. And physiologically, it's not a big deal. Usually the first outbreak can be very painful, but it's manageable. But moving into a relationship, then they have to disclose that they have herpes, and it comes along with this stigma. And so you have to be considerate of that, because a lot of times when you deliver the news that someone has HSV2 or genital herpes, it's devastating because they think about nobody's ever going to want me again. This is terrible. And you hear the jokes. It's a gift that keeps on giving. And like, that's the worst case scenario. And so, part of giving comprehensive and holistic health is to address managing that, educating them, so it's not as devastating for them. And kind of bringing it back to, you wouldn't not date somebody because they had a fever blister every now and then. It's the same thing. It's just not on your face. It's in your pants. And again, the physiological part of it is not really a big deal. And so you want to focus on the hurt, because that's part of health too.